Welcome to the webinar, Responding to Strong Emotions, Sadness, Anger, and Fear. I'm Barbara Lewis. Thank you for joining us. This webinar will last about 30 minutes, and if you have any questions, you can type them in the Q&A box. If we don't have a chance to get to your question during the webinar, we will respond afterwards. Before we get started, let me talk briefly about .com. Responding to Strong Emotions actually is a free module on .com, and our presenters have recently revised the module, and those revisions will be posted soon along with new videos. So .com is a proven online interactive healthcare communication skills learning system. We have leading authors who are the modules, leading faculty, I should say, 42 interactive online modules, over 400 realistic videos, and we also have interactive videos, annotated interactive videos, which our learners really love. We have about 90 institutions that subscribe. We're in 20 countries, have been translated into 3 languages with over 90,000 subscribers, and we have 10 journal articles regarding the value of .com. Our presenters today are Dr. Rhiana Saunders, OBGYN Residency Program Director at the National Capital Consortium, Dupe Akinola, Associate Professor of Pediatrics, Neonatology at Wake Forest School of Medicine, Dr. Mary Manis, she is Assistant Professor of Primary Care and Clinical Medicine at Sam Houston State University College of Osteopathic Medicine, and Dr. Mitzi Scotten, who is Associate Professor of Pediatrics and Director of Clinical Simulation at New York Institute of Technology College of Osteopathic Medicine in Arkansas State. And I'm going to turn this over now to Dr. Saunders.
Thank you, Barbara, for that kind introduction. I have been blessed to work with 4 wonderful academic leaders in healthcare, and together we are going to provide to you this module on responding to strong emotions. And we've broken it up into 5 different objectives. To begin with, we're going to describe the etiology of strong emotional responses in patients and caregivers. We're going to then identify 3 common types of strong emotions demonstrated in the healthcare setting. We're going to describe the impact of emotions on healthcare outcomes. We're going to identify and apply appropriate communication strategies to minimize strong emotions in patients and caregivers. And lastly, we're going to recognize extreme emotional responses that may indicate psychological problems. Next slide. So then, next slide. So to begin with our first learning objectives, we want to describe the etiology of strong emotional responses in patients and caregivers. Next slide. All right, so each individual experiences and expresses emotions in unique and individual ways influenced by his or her upbringing, cultural norms, and personality. As healthcare providers, it is important to recognize that strong emotions can have bidirectional influences. So a patient who's expressing anger can elicit a similar response in his or her healthcare provider, and the same in reverse. So these strong emotions, in a sense, can have contagious influences. As a healthcare provider, it is important to recognize that these emotions are unique and individual. It's important to recognize that we may respond in kind. We want you to be able to still elicit your emotions to feel and think along with the patient, but also to be able to objectively name or identify the emotions that are taking place so that you can create clear boundaries and enhance the clinical effectiveness. Next slide. So considering things from the patient perspective, it is absolutely normal for a patient to feel anger or fear or sadness in response to injury or illness. These types of strong emotions typically originate in the experience of or anticipated experience of loss. So for example, loss of eyesight, loss of use of the limbs, loss of reproductive potential, loss of life. All of these experiences can elicit strong emotions in your patients. And when we, next slide. When we as providers are able to identify and objectively name these emotions, neither good nor bad, we're able to then better understand our patients, recognize our own emotions in response to what the patient is experiencing, and to empathetically respond in healthy, productive ways while avoiding counterproductive reactions. Next slide. And with this, I lead to Dr. Akinola.
Thank you, Rhiana, for taking the first learning objective for this session. I will be taking the second and third learning objectives for this session. And we will start off by identifying 3 common types of strong emotions that are demonstrated in the healthcare setting. We must realize that emotions can arise from our patients, for those of us who do pediatrics, from the parents of our babies, from clinicians also, and also from interactions between healthcare providers. When we acknowledge and explore emotions, we will build effective relationships in healthcare. Next slide. We're going to be talking about 3 strong emotions today. The first is sadness, and sadness simply is being unhappy about a situation. So when we talk about sadness, it's an emotional response to discouragement. It's an emotional response to disappointment. It is a response that patients feel when they have a diagnosis that's not good, or they have an outcome that they're not expecting. Closely related to sadness is fear, and fear comes when there's an anticipated loss. Fear is the emotion that alerts us to the presence of danger, or it's very unpleasant, and it's a belief that there might be pain coming along, with a particular situation, or there's a threat of harm in a particular situation. So both sadness and fear are common emotions that are strong emotions that we see in our patients. The last emotion I'm going to talk about is anger. And anger is an emotion that is a reaction to injury, to loss, or a potential loss. It's a defensive behavior against a threat. Anger is a strong feeling of annoyance or displeasure or hostility, and it is the feeling that makes someone want to hurt others. And anger actually is an emotion that is a secondary emotion to sadness and fear. Next slide, please. People sometimes fail to acknowledge anger because it is perceived as confrontational. And so as healthcare providers, we probably want to shy away from the angry patient or parent and not confront them. When anger is expressed, however, clinicians need to explore its association with loss and provide support and also provide appropriate interventions for the patients who are experiencing anger. Next slide, please. Our third learning objective will be to describe the impact of emotions on healthcare outcomes. We know that human behavior is driven more by emotion than logical thought. And in highly emotional states, the ability to use cognitive reasoning is compromised. Next slide, please. Next slide, please. Clinicians most times will disregard emotions because of these reasons. It may be that they're inexperienced in handling strong emotional responses. Also, time constraints in a busy clinic, a busy intensive care unit, or an inpatient setting where there are lots of other patients who are competing for the physician's time or the clinician's time might lead to an inability to respond appropriately to strong emotions. Thirdly, a focus on the biomedical aspect of the encounter may be a reason why clinicians disregard emotions. So the physician may feel that they want to share the results of the MRI or share results of a lab work, and not see the patient that's sitting in front of them who is upset because he's got a diagnosis that has altered his life. There are benefits to acknowledging emotions in our patients. The first is that it increases efficiency and it builds trust. It builds that doctor-patient relationship. It increases clinician-patient collaboration, and it improves the clinician's therapeutic effectiveness. So what are the possible responses that clinicians could have to strong emotion? The most common is the reflexive reaction, which is to guide the interview away from the emotion and not address it. But the appropriate response will be the empathic response, which is the response that guides the clinician to take effective action and encourage hope in the patients. I'm going to turn it over now to my colleague, Mary Manis.
Mary, before you start, I just wanted to mention that these slides are actually on timers, which I didn't realize. This is the first time it's ever happened to me. So they're advancing automatically, and that's why I have to bring them back. I so apologize.
Okay, well, thank you. I'll do my best to keep up with the timer. Thank you, Barbara. Learning objective number 4, identify and apply appropriate communication strategies to minimize strong emotions in patients and caregivers. Expressions of empathy, both verbal and nonverbal, along with an authentic desire to understand people, are the most effective ways to connect with patients. Empathetic responses show that we understand that the illness and not the patient is the problem. Patients cannot infer empathy from their clinicians, and they need to hear you speak empathetic statements out loud, in addition to showing nonverbal expressions of empathy. Clinicians powerfully signal their genuine concern when they respond to emotion with empathetic statements, especially when dealing with significant pain or distress, or with a diagnosis that is elusive, or with treatments that are not necessarily effective. Empathetic statements accompanied by non-empathetic body language will generally be perceived as insincere. Both are very necessary. Patients experiencing strong emotions do not need you to fix them or their emotions. Rather, they need your empathetic response. When you try to fix them or their emotions, patients perceive that you do not understand their experience or that it does not matter to you. Next slide. Effective clinician responses to strong emotions require empathy. What, we might ask ourselves, does it feel like to be that patient, to live in their body, to view the world through their eyes? And how can I help? In other words, I'm trying to understand and I want to help. When responding to sadness, give respect and empathy. Give the patient control over whether and how to discuss the emotion that they are experiencing. When responding to fear, give respect and empathy. Demonstrate understanding that experiencing illness can precipitate fear. When responding to anger, give respect and empathy. Understand that anger is a normal response to injury, loss, or a perceived threat. In doing these things, clinicians build trust, and trust helps patients and their clinicians explore illness stories and generate therapeutic options more efficiently and effectively. In other words, time spent on empathy on the front end saves more time and improves outcomes on the back end of care. The need for clarity during discussion of the complex biomedical aspects of illness often distracts clinicians from responding to patients' emotions. It can make it difficult to find the best words to genuinely express empathy while still aiming to educate, counsel, and recommend treatment options to patients. 2 mnemonics can help clinicians find words with which to respond in stressful situations where complicated or urgent biomedical features are prominent. The mnemonic nurse, for instance, includes name, understand, respect, and support. Next slide. Pearls include statements evidencing partnership, empathy, appreciation, and apology when necessary, respect, legitimization, and support. Both beginning and advanced clinicians report that feedback from their patient interviews convinces them that practice with nurse or pearls eventually results in greatly improved relationships. As with any medical task, like suturing or interpreting diagnostic studies, performance improves with rehearsal and practice. Next slide. Let's look at an example using the mnemonics. For instance, sadness. This may be apparent when a clinician approaches the patient's bedside or enters the patient's room, when a patient may be crying or appears withdrawn or is just staring at the floor. The clinician cannot initially know whether these gestures relate to a health concern, a social issue, maybe depression, or something else. Thus, it can be empowering for a clinician to simply name the apparent emotion when the clinician mirrors, echoes, or reflects on the emotion with a statement like, "You seem sad," maybe, "You seem upset," "You seem down," "You seem particularly thoughtful today." Patients tend to value attempts to comprehend their situation, and even if the clinician is wrong in naming an emotion, patients usually respond with either grateful appreciation or more accurate naming of their emotion, both of which helps the situation. Next slide, please. Let's look at empathetic response to sadness using pearls. When the clinician has some notion of the cause for the emotion, understanding, respecting, or legitimizing the patient is the appropriate next step and demonstrates the clinician's willingness to understand the reason for the emotion. Statement like, "These last few months of your wife's illness have been really hard," would be an example. Next slide, please. Some other examples. "I'm impressed with how you coped with such a devastating loss. Losing your job when your husband has been out of work must be very scary. Losing a child is the worst thing most people can imagine. It can be hard to imagine how to go on living. The last few months of your wife's illness have been really hard." Additionally, support partnership statements align the clinician with the patient, emphasizing that the two are on the same side and working for a shared goal of improved health. "I'm concerned about you and want to help you feel better. I'm hoping we can work together on that." Next slide, please. Empathetic response to fear. Very important. Medical events such as motor vehicle accidents or worsening clinical situation can precipitate intense fear. Assist patients who are experiencing fright by helping them bring fears into the interview where you can show your understanding. Resist invoking false reassurance, though. It can jeopardize trust and the therapeutic alliance that provides the clinician leverage for supporting patients. You should never diminish hope, however, as even when death is the outcome, hope is available in the manner or management of dying, and in spiritual domains, in the people and accomplishments left behind. Next slide, please. Your initial response to concerns patients' names should be to make an empathetic statement. Sometimes simply naming the fear or hearing that particular concerns are understandable or legitimate can diminish fear. If uncontrolled pain is the concern, understand this and reassure the patient of the effectiveness of and access to medication and your sincere attempt to help them. If spiritual concerns are the issue, understand this and suggest consulting appropriate pastoral services. Alleviate the sense of isolation by offering to refer to a counselor, to a support group, or simply by proffering your own constant presence. I'm here to help you. Next slide, please. Often a lack of control over future events or the idea of facing the unknown alone drives the intensity of fear. So taking any positive action, such as assuring patients of your support, can confer a sense of control. Feeling unattractive or tainted by illness can increase a sense of alienation. Sometimes the patient's specific fears are realistic and/or terrifying, such as the diagnosis of a fatal disease. In these situations, the expression "I wish it were different" supports patients by communicating caring and sharing their perspective. I'm going to be here for you and help you through this. What help would you like in order to deal with this problem? Whatever struggles you'll face with this illness, I'm here to help, and I hope you will reach out when you need something. Next slide, please. Empathetic responses to fear. Now, ignoring patients' anger, changing the subject, or trying to persuade them not to be angry tend to only escalate the anger. Remember, you can express your understanding without agreeing with the other person. Clinicians are often reluctant to understand or legitimize a patient's anger for fear of adding fuel to the fire, but especially because not feeling heard often arouses patients' anger. Understanding, legitimizing the feeling is helpful, typically not harmful. Most clinicians find it difficult to verbally understand and to express empathy with patients by whom they feel attacked, but the same skills useful in other situations are equally useful with anger. Next slide. Empathetic response to anger. Using this language does not mean that you agree with patients, only that you have heard them. Something like, I can understand that you would be upset with me for not prescribing the Vicodin when that's the main reason you came in today. It's difficult to care so much and feel that you have so little control over what happens. Support partner statements that affirm the clinician's investment are also helpful. I understand that you're angry and I want to help. I hear what you're saying about how much pain you're in and I want to help you feel better. I don't think that the Vicodin is a good option for you, and I'm committed to working with you to develop a safer plan for managing your pain. Let's see if there's another way I can help address your concerns, or perhaps others on the healthcare team can assist us. In other words, the anger is usually not about us, and we're not responsible for the patient's anger or for fixing it. However, we do help patients when we take the time to become mindful of their pain or loss or other distress and genuinely attempt to make an empathetic statement despite feeling attacked. Keys: respect, empathy, see the patient and not just the disease, use your tools and practice them. Now, Mitzi, I'd like to turn it over to you for learning objective number 5.
Thank you very much, Dr. Manis. So our last learning objective is to recognize extreme emotional responses that may indicate underlying psychological problems. When emotions make us uncomfortable or we lack the confidence in our ability to respond to them, we may try to ignore or distance ourselves from the patient or try to make those emotions go away instead of trying to understand the patient's experiences. By exploring the patient's emotions, it enables us to understand and increase our capacity for caring for that patient. So exploration is the main tool in overcoming our own discomforts and or lack of confidence in very charged situations. Next slide. So what does the clinician do if their empathetic responses fail? The first thing is to do a self-check. Reflect on your own emotional state. Has the current interaction with the patient made you so emotionally volatile that you may be getting angrier or more out of control than what you thought? Seek more information from the patient. You can always ask more questions, and by asking those questions, you many times come to a greater understanding of where the patient's coming from. You also want to modify your self-behavior. Again, look at your tone of voice, look at your stance or how you're interacting with the patient, and always maintain professional demeanor. You may actually slow down your speech, slow down your thought, so that you don't say things that you might later regret. One of the most important parts of dealing in situations like this is negotiation. And negotiation between the clinician and the patient are so important because you can find alternative approaches from the original stance that maybe both of you came in with. You need to set boundaries in situations. And if situations become out of hand or you feel uncomfortable, then it's recommended that you seek assistance, whether that be a supervisor, a partner, or even security, because the most important thing is to ensure the safety of yourself, your patient, and everyone else around. Next slide. One of the most important things for clinicians to understand is that after an intensely charged situation, it is completely normal to feel shaken. And it's the norm. So you need to come out of that situation and center yourself. Reflect on the experience and ask yourself, where did my emotions come from? Did I listen to the patient and do my best at trying the empathetic responses that we've discussed prior? And did I set limits and boundaries to my own emotions? And if I noticed myself becoming angry, was I able to control that emotion within myself? Next slide. So a summary of our key points is that emotionally charged encounters can generate strong but also rewarding relationships with patients who will benefit greatly from experiencing your attention, your empathy, and your compassion. For people that are starting out and may not have a lot of experience in dealing with strong emotions, the mnemonics NURS, nurse, and pearls are effective ways to partner with patients. It's a way to explain their emotions and also garner trust for effective and therapeutic interventions. And finally, these experiences present important professional challenges while also simultaneously promoting great personal and professional growth. Next slide. So I think that brings us to the end of our presentation. Thank you very much. I'll let Barbara take over from here.
Thank you so much for this really important information, and it seems to be more important now than ever. And we hear about these very strong emotions, not only in clinical situations and in healthcare situations, but just in the world in general around us today. What comes to mind are the airlines and all the issues that have happened there. So thank you. We have a couple of minutes left, so if you'd like to put any questions in the chat, please feel free to do so. If you'd like more information, or if you'd like a 30-day trial subscription of .com's 42 modules, no credit card is required. Please email me. I have a very easy email, bal326@drexel.edu. And this particular module is available free along with three other modules, I should say, and you can find that on the site .com.org. That's DOCCOM.org. So we do have a question that came in, and it says, please make some suggestions for setting boundaries. Do one of you want to take that? Actually, we do have an entire module on boundaries in .com, which you might be interested in. And if you'd like a trial subscription, you could take a look at that. But any one of our panelists today want to take that?
I will. This is Dr. Manis. I think that's a great question. And my opinion is yes, those skills can definitely be used for emotional encounters with colleagues. We're all familiar with anger, sadness, and fear in the daily practice of clinicians. And it does affect those around us, healthcare team members and colleagues. So yes, I think these are excellent tools to deal with those issues also. Anyone else on the panel?
I think I would agree with that, Mary. I think the question was, can these same procedures be done on coworkers and other people on staff? And yes, I think for whatever reason though, we tend to shy away from that for reasons unknown. But we may be more empathetic with a patient than one of our own coworkers, and I don't exactly know the reason for that, but I do see that as a problem sometimes. And yes, these same mechanisms that we just described can absolutely be used for anyone on a team setting.
We have another question that came in. How do you recommend that trainees respond to racist comments from their patients?
So this is Dupe. I think that confrontation is never a good thing. I think the trainee should discuss the racist response with the supervisor and let the supervisor speak with the patient.
Mm-hmm. I was also going to say I had an encounter actually when I was a nurse with a patient that was very abusive to me. And, I basically said, I'm sorry, but I don't feel comfortable being your nurse today. And I'm going to go talk to someone about getting the arrangements changed. And as Dupe said, then taking that to the supervisor and saying, I'm uncomfortable with this patient. And that decreases the chances of escalating the event into a higher level of emotion, I think.
Thank you very much. So I think we're coming up on our time now, and I want to thank you again for this great webinar, and to everyone who has joined us today. The recording and the PowerPoint will be on the .com YouTube channel shortly, and please contact me if you would like a trial subscription and no credit card required. Thank you so much.